Welcome to the BCUHB Pain Management Service information slideshow. This presentation will take around 13 minutes, and it is important that you watch it through to the end to help you understand what it is we do and how you can get the most from our service. There will be important information on what to do next if you wish to be seen by our team. Equally, if you do not wish to be seen in our service, you will have the opportunity to opt out, and we will explain how to do this at the end of the slideshow. Our aim is to support you in dealing effectively with your long-term pain problems and its consequences, using the specialist skills of our team. We use evidence-based therapies to provide best care. So why do we want you to watch this slideshow? If you do want to be seen in our service, you will go on to have a detailed individual appointment. And for most people, this will be very different from anything they have experienced before, and can involve seeing a number of healthcare professionals who will ask you all about your pain and all about the effects of that pain on your life. Why is this important? Well, to start to answer this, we need to spend a few minutes talking about the different types of pain. We have all experienced short-lived pain, or what we call acute pain. We will have experienced acute pain from our earliest memories in childhood. For example, we may have injured ourselves falling off a bike, tripping over, or having a paper cut. The pain we felt was a warning that we have injured ourselves. It caused us to protect, to rest, and, if necessary, to seek help. It told us that something wasn't right. As the body's tissues healed and the threat went away, so did the pain, and we naturally went back to our normal activities. This might have taken us a few minutes or even a number of weeks. Sometimes, though, the pain is switched on but does not switch off. It may even get worse and spread out as time goes on. You will have been referred to the pain service because you have a pain that will not go away or switch off and is now significantly affecting your life. We call such pain chronic pain or persistent pain. And the thing about persistent pain is that it's very different to what we might have previously experienced. Persistent pain is different to acute pain. So how is persistent pain different? Well, pain that won't go away starts to affect our sleep. It often causes us to worry about what it means and about the future. Anxiety and worry can make us feel more tense, and this can cause us to alter the way we move as we try to keep going as best as we can. But ultimately, we may lose strength and fitness, and this feeds back into our ability and desire to do things. Over time, we may become less active and not really want to socialise as much at all. And all this over time can make us feel quite low in ourselves. It can affect our mood. Now, you may think that if you tackle the central pain problem, then all this will go away, and people often try treatments such as injections, medications, and other treatments such as acupuncture and manipulation to help. Well, that's the natural way of thinking, is that if you remove the pain and fix the tissues, all this will go away and the other problems will disappear. But although they can temporarily shrink the pain, we often find that the other factors tend to stick around and prevent us from leading a normal life. So in the long run, this may not lead to a significant reduction in your pain. And what can be really distressing is that the usual ways that we expect things to work out don't seem to work for these type of pain problems. Everyone referred to our service will have had some form of investigation, blood test or imaging, but the investigations have not led to a cure for the pain, And for some people, investigations might have made them even more worried about the pain. So while investigations can be really important in certain circumstances, they often do not lead to a cure for persistent pain. Many, if not all people suffering with persistent pain will have tried medicines to reduce the level of their pain. But often, these produce unwanted side effects, and if not careful, we can end up on lots of different pills with no clear improvement in our pain or in our quality of life. Many people will have tried manipulation, and some may even have considered or had surgery. Yet, if you are watching this, the chances are that none of this has resulted in successful treatment that has enabled you to lead the sort of life you want or to deal with the pain in a way that is satisfactory to you. Nobody seems to be able to help. Everyone seems to give a different explanation, and you may feel a bit, written off or passed from one service to another. So with persistent pain, we need to do things differently. We need a different approach. So what does the pain service at Abergele do? We look at things that research tells us have the biggest influence on the experience of pain. We work on these things with you so that you can start to make changes in how you live alongside your pain and improve your quality of life. For example, we may look at positive goals like improving your ability to do things, get fitter and stronger, or look at how you get things done, all in the service of improving quality of life in whatever form that takes for you as an individual. We aim to put you back in the driving seat. And the amazing thing is that your experience of pain can change by taking these positive steps. Even for those people for whom pain doesn't reduce much, they still feel it has been worthwhile their attending because their quality of life has improved despite the pain still being there. So our service is about giving you a greater sense of control while living alongside your pain. And ultimately, to improve your quality of life. So who is in the pain team? We are a team of specialist nurses, physiotherapists, pain psychologists, occupational therapists, and doctors, all of whom specialise in dealing with persistent pain. When people first come to us, they may meet several members of the team. The first appointment can take up to 3 hours and is a chance for you to fully explain your pain and the effects of your pain on your life. With the detail you provide, we can look at where changes can be made for you to improve your current situation. The management of pain is an active process that does take time. It is not an overnight solution. We give guidance, but it demands that you need to do the work, which can be challenging. It can be hard. We have a long waiting list. Research tells us that as many as a third of the population are trying to deal with their persistent pain of one sort or another. And we find that people prefer to know a little more about what they are signing up for up front, rather than waiting a long time expecting something we cannot provide. What about some of the treatments that we mentioned before? In the case of injections, they are generally not repeated. Our experience in pain clinics up and down the country is that these treatments rarely prove themselves in curing persistent pain, adding to the frustration of other failed treatments. So occasionally, where pain can be directly treated, we will try, but more often we are looking to improve the other influences on your pain that may be relevant for you. We avoid putting great emphasis on getting rid of the pain directly. We also avoid subjecting you to treatments that have not been shown to cause lasting pain relief, or that remove your sense of control. So, to summarise, most people who engage in our pain service and learn techniques to live with their pain are able to live more easily and improve their quality of life. Often, this approach can lead to feeling less pain and being less disabled by pain. And this can be difficult and it can be challenging, and it needs your willingness to take an active part in your journey. So, what can you expect from us? Well, firstly, we will believe in you. We will work in a way that research suggests, not just use research to justify what we do already. We will work with you and not tell you what to do. And we will all give you the same messages, no contradictions. What do we need from you? Well, we need an open mind and a willingness to see that the usual ways of diagnosing and treating have not helped you much so far. We need a commitment to self-management. You are the expert in the problem as it applies to your life. We are experts in the general aspects of pain problems. And this approach only really works if you are able to attend all your appointments. Please note, we do have a non-attendance policy, and it's really important that you tell us if you cannot make an appointment, as failure to do so will result in discharge from the service. It's also important to know that the overall package of treatments work together, and that choosing to do some parts and not others is far less likely to be successful. Therefore, we do insist that if you agree to the plan, that you stick to all appointments. We are of course happy to discuss any problems you might be having with a particular part of the plan. So what now? You will shortly be given two options. If you would like to see the pain service, please click Opt In. We will then send you our detailed questionnaire in the post. Take your time to fill this in as accurately as you can and return it to us within 2 weeks to be placed on our waiting list. If we have not heard from you within 2 weeks, we will assume you have changed your mind and we will remove you from the waiting list. Your GP will be informed. If you do not want to see the pain service, please click Opt Out. We will let your GP know your decision. There are, of course, reasons why attending the pain service might not be right for you at this time. This could be, for example, that you continue to have other treatments and investigations elsewhere, or you feel that this will be wasting your time, or you feel that you are actually coping with your pain problem and don't need further support. Importantly, it's got to be the right time for you. We hope this short session has given you more information about the Abigaili Pain Service and how you can get the most from us. We also welcome any feedback to help improve on our services.